Thank you. I'm grateful for the opportunity today to discuss death certification relating to COVID-19 deaths in the state. The Office of the Medical Examiner, which is part of the Utah Department of Health's Division of Disease Control and Prevention, is responsible by statute to investigate specific categories of deaths. Among these, we are specifically tasked to investigate deaths that appear to be the result of a disease that may constitute a threat to the public health. Like all deaths that fall under the jurisdiction of the Office of the Medical Examiner, we receive reports about these deaths from a variety of sources, including attending physicians, hospital staff, law enforcement. During the current pandemic, as we are also investigating these COVID deaths, we're also working closely with the epidemiology staff of the Department of Health, as well as the Office of Vital Records and Statistics, to ensure that all deaths related to COVID-19 are reported to us. The Office of the Medical Examiner is involved every day, and was doing this long before COVID, in making determinations of cause of death in deaths that occur under a variety of circumstances. Part of that work involves determination of whether conditions that are identified either by history, by examination, or by lab testing are related to the underlying cause of death. For example, did this drug that was found in this person's toxicology results contribute to or cause their death? Is this significant heart disease, which we see on our autopsy examination, related to their cause of death, or is it something unrelated? And much of this kind of work that we do all the time involves sorting out a variety of potential causes of death to identify the cause of death in a given individual's case. There's been much discussion about what constitutes a death from COVID-19, and with so many individuals having advanced age as well as a lot of comorbid conditions, how can we be sure that these people are not just dead from these other illnesses and processes that were already going on in their bodies? COVID-19, the infection that results from infection with the SARS-CoV-2 virus, has been described as causing death by a variety of mechanisms, which range from respiratory failure, acute lung injury, sepsis, aberrant inflammatory responses, blood clots, and a variety of others. Clearly there have been a number of conditions that have been identified as potential risk factors for severe illness and death, including diabetes, hypertension, and obesity, among others. In Utah, COVID-19 deaths are reported to the investigation staff of our office through means, as I mentioned previously. Our investigators then take a history of events from the reporting party, including a review of the circumstances and events that led up to the decedent's death, a review of their medical history and issues, a listing of any positive test results they've had and when those were, and information about exposures to other individuals with COVID. Following this initial report, the OME requests medical records from hospitals, long-term care facilities, and hospice organizations and law enforcement where relevant. In some cases, we do additional follow-up with family members and/or certifying physicians to ascertain, gain some clarity on the specifics of what happened in the final days and hours of an individual patient. Most of the deaths that are reported to the OME are then reported by us to the Department of Health and are then reported publicly by the Unified Command. If the information that we have initially, based on history, clinical information, and what's on a death certificate is consistent, we will report those deaths. Some require further investigation before we report those on. Rarely, the information that we receive up front turns out not to be the case, and that's true of medical examiner cases, aside from COVID as well, that the initial story you get doesn't always turn out to be what you thought it was. Additional questioning raises additional answers that sometimes change the situation. In those cases where we determine that what was originally reported as a COVID death is not in fact a COVID death, we change that death certificate to remove COVID-19 as a cause. That has happened thus far in about 1% of all the deaths that have been reported to us. Deaths that result from trauma, drug intoxication, or other obvious non-COVID related causes are not reported as COVID deaths, but are reported as positive tests if the individual tests positive. So all deaths in Utah reported to date have been based on positive test results, as well as history and symptoms that are consistent with COVID. The robust system of checks that we have in place to identify the deaths, the investigative and review process that we have to ensure that what is reported is consistent with that certification, as well as then the normal processes of the OME to ensure that deaths from COVID-19 that occur outside the medical care system are also found and identified. So in summary, all of the deaths that we see in this state are thoroughly adjudicated, if you will, reviewed in depth to the degree necessary to make an ascertainment as to whether COVID is in fact appropriately part of the cause of death. And thus far we have, as I said, had to change very few and are confident in the numbers that are being reported. Thank you.